Welcome back to Everyway Woman. We're here with Dr. Kapoor from Breastlink Services. We just want to talk about treatment for breast cancer and some of the recent research in the year 2012 and how we've evolved.
Absolutely. I mean, that's the good word to use, evolved. I mean, really, we're doing early detection. We're screening people much earlier, catching cancer much smaller. We're doing less big surgery, so much smaller surgeries.
And how can we detect cancer even earlier now as a patient? What can we do for this?
Yeah, because I've wondered with mammograms, you know, in some ways they tell you to have mammograms early, but then there was a big controversy of
there was,
radiation.
yeah.
What
There
can you
was
tell
a
us
big
about that?
controversy. We still firmly believe that age 40 and yearly is the way to go for screening mammograms.
So are mammograms always accurate?
Always accurate. Oh, wow, that's a tough question. It depends on the density of the breasts, actually. Patients with very dense breasts, it's harder to screen them. So that's one issue. If patients have implants, that becomes another trickier issue. Patients who are very young will also have dense breasts, harder to screen.
So when you talk about treatment, what are the stages of breast cancer and kind of the treatment that applies at each stage?
That's important. You know, patients want to know right away, what's my stage.
Right.
Stage depends on a number of things. On the size of the cancer, on whether or not it's spread to the lymph nodes, and whether it's spread even and beyond those lymph nodes in the rest of the body.
What does it mean when a cancer spreads to the lymph node?
It means that it's gone beyond just the breast, and it's a little bit more advanced stage. So it's not stage 0 or stage 1. You're getting into stage 2 and possibly 3 even.
Well, because lymph nodes are also, you know, they kind of are centralized in different regions, and so
throughout
can
your
affect
body,
even more organs. Is that correct?
Yeah. But we have better treatments, and now in some cases, even when cancer spread to the lymph nodes, we can just treat you with even less surgery now.
What are alternatives to surgery?
Alternatives to surgery, well, when you have breast cancer, we like to remove it, and that's done with surgery. A lot of the times we do treat with medications, either chemotherapy or pills, before surgery and try to shrink that cancer. And that's something that's really advanced. We partake in a lot of this research at Breastlink and all over the country, actually. It's very active research and understanding how we shrink tumors. And so giving treatment before and watching the tumor shrink gives us a lot of information.
So does everyone have the same side effects? I mean, would my side effect differ from chemo or treatment than Sandra's? Or
very different. Everybody's very different.
What are some of the common side effects that you talk to patients about prior to them going in treatment and deciding what type of treatment they're going to get?
Sure. Well, the pills that we give, like tamoxifen and aromatase inhibitors, those can have side effects that are similar to menopause, like hot flashes. Those are more common. Chemotherapy is one of those poisons that we all have heard about and know about. Patients tend to lose their hair and get some nausea, but again, everyone is different.
But I think the thing, you know, that you're kind of bringing up with all the research and treatment, that it's not necessarily a death sentence, and especially now. I mean, is that
definitely not. No. I mean, early breast cancer is 99% cured. In 5 years, you don't see any problem.
And it's really crucial that women be taught early. I think, you know, early
and
on
take charge of
to
their
do
treatment.
self-exams, be aware, and don't wait. That's important.
Can I ask you an urban legend about breast cancer? Is it true that if you wear a bra all day, you'll get breast cancer?
Absolutely not.
Amen. So take it off, keep it on. Where can we find more information on Breastlink?
Well, Breastlink.com. We have a full website with all kinds of links to awareness. We have a nonprofit organization called BeAwareFoundation.org that gives you links on self-exam and then resources in the community about where to go.
And we'll have more information for you at everywaywoman.com. Stay tuned.